Hello dear students, welcome to an introductory class on Occupational English Test by Nudge Learning Solutions. So this will be a basic class detailing with what OET exam consists of and a basic session on how to approach writing and speaking tests of Occupational English Test. Now, as we know, the OET or Occupational English Test is a evaluation test of your English proficiency, and this occupational test is taken by healthcare professionals from 12 different professions. It includes doctors, nurses, physiotherapists. All these healthcare professionals take the occupational test, and in this test you will be assessed in your listening, reading, writing and speaking skills. So based on your responses to different questions on these tests, you will be given a grade and a mark. You'll be given a grade between A, B, C plus, C until E. Okay, and similarly you'll be given a mark between 0 to 500. So for each subtest, for listening test you will be given a grade, for reading you will be given a grade, for writing you will be given a grade, and for speaking also you will be given a grade. And unlike IELTS, other exams like IELTS, there is no overall score in occupational English test. And also remember that in occupational English tests, the listening and reading questions are common for all the 12 professions. At the same time, the writing and speaking subtests are specific for the profession. For example, the writing test of a nurse would be different from the writing test of a doctor. Similarly will be the case in speaking also. So there are 4 subtests which will be graded A to E and 0 to 500. Now, normally, this is another representation of the scores. For each subject will be provided with a score, and normally all the professionals try to target to score above B band or a score which will be almost above between 350 to 440 at the minimum. So this is a target that normally students keep while they start preparing for the occupational English test, which that is equivalent to 7 to 7.5 in IELTS. And normally what is the score required otherwise? So let's look at each countries and let's see what are the OET scores that the different nursing bodies, regulatory bodies of Ireland, UK, Australia and New Zealand mandates as of now. These are the scores required as of now for these bodies. These requirements will change periodically. The institutions update the scores. As of now, Ireland requires you to score B band in any of the 3 subtests, and they allow you to score C plus in any 1 subtest. So 3B and at least 1 C plus is the basic minimum score to qualify the English requirement to work as a nurse in Ireland. And when you come to UK, they also have a similar procedure. You need to have at least 3B and 1 C plus in any of the components, any of the subtests of the OET. But one advantage with regard to UK is they allow clubbing. Clubbing means you can suppose you took a test in December 2010 and suppose you got B, C plus for reading, for writing and speaking. Suppose you got this score. So if it's a case in Ireland, you won't be allowed, you won't be eligible. Your English requirement is not satisfied. But if it's in UK, you have this option to write another exam within 6 months. Suppose you write a test in 2011 and suppose you get C plus, B, B. The last B being for writing and speaking. You have an opportunity to club these scores. So the score you lost in writing, score in you lost in writing or speaking, either of it can be compensated by the B plus that you got in the another exam that you have written within 6 months. So that is a unique feature of UK, where you can club two scores. So here, so that you can meet the requirement of 3B and 1 C plus. So in Australia, there is no provision of C plus. You need to get B in all the bands. Similar is the case in New Zealand. You need to get B bands, but both nations allow clubbing. So you can merge two different results, either between 6 months or between 1 month. You can merge the result and you can submit to the body. So basically, we should target to get B, at least B, in all the 4 components. That is the target, and the nudge will be teaching you all the techniques and tricks, so that and the practice and detailed practice sessions to ensure that you're getting B in all, at a minimum of B in all the subtests. Now, what is this test consist of? So as I said, there are 4 subtests: listening, reading, writing, and speaking. When it comes to speaking, there are 42 questions in listening test. So there are 3 parts: part A, B, and C. And part A consists of 24 questions, part B 6 questions, and 12 questions. So in listening test, an audio tape will be played. In part A, it will be a conversation between 2 patients, and in part B, it will be a dialogue or a monologue. 6 dialogues and monologues will be provided to you. And part C, it will be two conversations or an interview or a presentation will be provided in part C. Don't worry about, I am not going in detail about listening and reading in today's class. That we will cover when your sessions begin. Today we'll be focusing more on writing and speaking tests. So, but I will give a very brief introduction of reading and listening. So, listening consists of 42 questions. So, out of this 42, you need to get at least 30 out of 42 correct, so as to get a band of B. To get B band, you should get at least 30 questions correct out of the 40 questions. Similar is the case in reading, where you need to get 30 questions correct out of 42. So in reading, there are 3 parts, as in the case of reading, as in the case of listening. So part A has 20 questions, part B 6 questions, part C 16 questions. So part A has 4 text will be provided. From based on that you need to answer. In part B, 6 texts will be given. Based on that you need to answer. And in part C, 2 texts will be given, which will be of a length of 2 pages each, and you need to answer. And at least you should get 30 correct out of the 42 questions. So that is about listening and reading. Don't worry, when we start our sessions, we will be coming in detail and deal with how to answer listening and reading questions. Now coming to writing and speaking. So to give a general overview, in writing test, we are supposed to write one letter in a particular context. For example, you are transferring a patient for a better care to another hospital. So you write a letter accompanying the patient saying that these treatments were taken at our hospital and you need to continue this patient's care in your hospital. So we write a letter, or suppose you are discharging a patient, you write a letter to the community nurse saying that, okay, we are discharging this patient, so this patient has undergone these treatments at our hospital, so please provide a continuity of care. So mostly we will be writing referral letters or discharge letters or transfer letters. So such different types of letters are there. So we have to write one letter as a response to the question that is asked in writing exam. So we need to write a letter which would be around 180 to 200 words within a time period of 40 minutes. So that is about the writing test. Now when you come to the speaking test, it consists of something known as role play. This is very unusual. People who have written IELTS mostly would have seen that they have an interview in IELTS exam where the examiner will ask you questions and you will reply, or you speak about a topic for a few minutes and after which you have an interaction with the examiner. But in the case of OET, you have a scenario known as role play. In role play, you will be provided with a particular situation. Suppose you are a nurse in an emergency ward of a hospital, and you will be acting as a nurse, and the examiner or the interrogator will be acting as a patient or a patient's relative and will be asking you some doubts or clarification or help, and you need to respond to their needs accordingly. So that is the uniqueness of the speaking test of OET. So there will be initially a warm-up question followed by one first role play. After that there will be a second role play. So warm-up plus role play 1 plus role play 2. This is the structure of the speaking test of OET. We will come back to this. So now we will take some time to understand the writing test in detail. Writing is considered to be one of the toughest tests by most of the candidates because it requires a precision in your grammar, precision in how you organize your answer. It requires a balance of lot of skills. So let's try to understand what this test consists of. Now, as I said before, in writing tests of subtest of OET, we are supposed to write a letter. The letter might be a referral letter, which is the most probable case. Most commonly they ask us to write a referral letter, or we need to write a discharge letter, or a transfer letter, where we are transferring the care of the patient, or an information letter, information in which we are providing advice, or a particular information is given to the professional or a patient related to it. Now, to whom are we writing this letter? This letter might be written to a doctor, who might be a specialist like neurologist, or just a general practitioner. So it might be a doctor, or we might be writing to another nurse who might be a community nurse or a nursing unit manager, or any other allied health professionals like a dietitian, a physiotherapist, or a non-health sector professional like social worker. Even there is a probability of writing a letter to a parent of a school where you are working as a school nurse. So such diverse scenarios can occur, and according to the case, we need to write referral, discharge, and information and transfer letters. So these are the different variations of the question, the letter question, that we normally face in the OET exam. Now let's go directly into the question and see how this question looked like. Now when you appear for the exam, we'll be provided with something known as the case note. The case note contains certain details about a patient, and based on that we need to write the referral, transfer, or discharge letter. So the case note will be detailing some information about the patient. Let's try to understand what are these information. So first they will be giving a note on who is the patient. The patient's name, George Chien, is a 54-year-old patient in the medical ward in which you work. So we know that we're working in medical ward. We know the age of the patient and his name, and in which hospital. Again, the same information is provided: the name, the marital status, the residence of the patient, and the house, the family members of the patient, and admission date. Admission date being the date on which the patient was admitted to your hospital, that is the St. Andrews Hospital. So when was the patient admitted? The patient was admitted on 10 January 2008. That is the first part of the case note. The case note will also have information regarding discharge date. Discharge date is the date in which the patient is discharged. So he was admitted on 10th and he is getting discharged on 12th. And the social background of the patient: he is an accountant, he consumes alcohol 2 to 3 units in social occasion, He's a non-smoker. He enjoys watching soccer and walking dog. And these are the social background, and almost all letter contains a critical medical background, which is very important. So the patient is suffering from osteoarthritis. Okay, so look at the patient has undergone a total knee replacement, and his mobility is have some issues. He had fever, and he has a history of shingle. So this is the medical background, the medical history of the patient. Most probably such histories come before the admission, before the patient was admitted to the hospital. And after admission of the patient to the hospital, some details are provided. These are the admission details. Here, some details like, the patient has underwent total post right total knee surgery. So this is the procedure the patient has undergone in the hospital, and the patient has impaired his mobility following the procedure. Then there is a case of anemia, post-operative anemia. So these are the procedures that the patient has undergone. Now, what has been the progress of the patient? So that is also provided. So anemia has been there, discomfort was there, swelling came. So such details are also provided. Then what else is provided? The nursing management, what all care was given to the patient at the hospital, supervised for bed mobility, ambulation, assistance in ambulation, patient supervised for grooming. They observed that the patient is eager to go home. The painkillers were provided. These were the procedures, the further care the patient was provided. Now further, the final assessment before discharge, that is, the patient is at present medically stable. Now comes one of the most important part of the case note, that is discharge plan. What needs to be done now? After the patient is discharged, what needs to be done? So the patient is discharged with family assistance, regular diet is needed, rehab is needed, the patient has front wheel walker, okay, okay, the same information is repeated here. So these are the aspects, that is the future of the patient. So these are the components of a case note: the name, the social background, the medical background, the admission details, the nursing management, the assessment, the discharge plan. These are it may vary from question paper to question paper, but general structure is these components. And then there is one of the most important component in the question paper, which is known as the writing task. Based on these questions, based on these information, we are prompted to write a letter. So what kind of letter are they expecting us to write? Let's read the writing task. Using the information given in the case note, write a referral letter to Miss Loretta Pasquale, who is a physiotherapist at the Templetown district. Okay, now we are supposed to write a referral letter. Okay, we understood what is the type of the letter, and what else needs to be done. To whom are we writing this? We are writing this to Loretta Pasquale, who is a physiotherapist, okay, in a particular location that is given with regard to Mr. Cheyen's rehab. Yes, if you look at the discharge plan, it has mentioned that the patient is in need of comprehensive rehab. For that purpose, we are writing a referral letter to a physiotherapist. So this is the structure of a question. So there will be a writing task. So now on, whenever you get a case note, first try to read the writing task. So when you read the writing task, you will understand, okay, what is the need of the patient and to whom are we writing this patient. After understanding what is the writing task, then go from top to bottom. Understand the name of the patient, social background, medical background, nursing management, discharge plan. So this is how you read a question paper. We'll deal in detail. At times they may use symbols in question paper. What to do about it? At times we need to write complete sentences from the keywords given in the question, what to do then. These we will deal in our in our practice sessions, we will deal in length, but as of now this is the general information that I am providing with regard to this. Now, how would an answer look like? How do an answer look like? The case note was the question. How do we answer to this question? So we begin by writing a date. So we can write 12 January 2018, that is the day of the discharge. So that we write here. Normally what happens is in exam hall, on the test day, the test date will be provided as the discharge date, and you will be writing the test date here. But since our discharge date was given in the question paper, I just wrote it there. So it can be written like this, or you can write it as 12/01/2018. So either way you can write. Then we write the receiver's address, that is Miss Loretta Pasquale, the physiotherapist, to whom we are writing this letter to. Then we give a salutation. Dear Miss Pasquale, we put the surname. Dear Miss Pasquale, we give a salutation. After that, we give a very basic detail of the patient, that is reference. We are writing it in reference to Mr. George Chian, and also in OET letter we tend to write the age of the patient so that the physiotherapist or the healthcare professional can provide the care accordingly. So we write the name and age of the patient. So that is in the reference section. Then after that we introduce the case. We give a very crisp one sentence about detailing the purpose of the letter. So here in this model letter, Mr. Chian requires your professional assistance for his ongoing difficulties with mobility following recent. So we just learned that he has underwent knee surgery. Okay, so following that he is having mobility issues. So we need a professional assistance from the physiotherapist. So that is now explained here in the introduction. So we write the purpose of the letter in our first line of the body. Remember that normally the OET will only assess the part that is in the body of the letter, not the salutation and reference, etc. So they are focused more on the body of the letter. Okay, so that is the introduction. You write what is the name of the patient, what are the key support that the particular patient is requiring. That will be mentioned in the first line of the letter. Now, what do we write in the coming paragraph, in the following paragraphs? So we can hear what is being written. So in the following paragraphs, we provide a brief detailing of what is the background of the patient, what has happened to the patient, that is prompting for a request for professional assistance. So here the writer is the student, the exam taker is writing about the most recent event, that is Mr. Chain was admitted to St. Andrews Hospital 2 days ago, suffering from swelling and fluid buildup in the right knee, which was a result of total knee replacement that he underwent on 2017. So they're providing what is the context, why is the patient having the trouble, having the difficulty, because he came to the hospital with a history of complications following total knee replacement, and following that he has underwent a surgery. Okay, and then what is the present status of the patient? So now what was the care given to the patient? So during the care, the swelling was treated well, painkillers were provided, he was supervised, now he's using front wheel walker. So what treatment, the nursing management, that aspect has been provided in brief to the physiotherapist. And finally what is being given? A plan of care. What should the physiotherapist do? That is provided. Mr. Chain is now medically stable and ready for discharge with the assistance of his family, who will supervise, and kindly provide acute rehabilitation, acute and comprehensive. So this is the plan of care. The plan of care means the action that needs to be taken by the physiotherapist. To summarize, in the body of letter, after writing the date, the address, the salutation, the reference, the first thing that we write is the purpose of the letter. Why are we writing this letter? We are writing for professional assistance for mobility of this patient. Then next, what do we write? We speak about what is the immediate concern, what is the history. History is the patient had to undergo a total knee has to undergo a surgery, which was a result of a total knee complications following a total knee replacement that we spoke in the second paragraph. After that we are telling the physiotherapist about the treatment that the person has underwent. Then finally we provide what needs to be the action from the side of the physiotherapist, that is provide him acute and comprehensive rehab. So that is the general structure of a response letter in the OET exam. And finally we give a conclusion by saying, if you have any queries, please free to contact me. Then we sign off by saying yours sincerely. If we know the person's name, here we know the physiotherapist's name, that is Pasquela. So you write sincerely. If it is not a person, if the name of the person is not given, so suppose we write dear sir, madam, and we sign off by saying yours faithfully. Alright, and finally we give our designation, so that is a nurse. Alright, so this is the general structure of an answer in OET exam. Now just explaining the same thing. So first we write the date, then the address, then the salutation. In salutation, if the name is provided, in this case it was Miss Pasquale, we will write that Mr. or Mrs. Miss. Then if the name is not given, we write dear sir or madam. Then in reference we write the patient's full name and the age. Alright. In introduction we provide the purpose of this letter. That is, in this we will say this patient is need of in this particular treatment, and he need this particular type of assistance from your side. That is introduction or the purpose of the letter, following which we provide a relevant medical history. So here we spoke about the osteo, the total knee replacement and the swelling, and following which the patient is having mobility issues and the patient is needing support from the side of physiotherapist. Finally, we provide plan of care. Plan of care means what is the support that is particularly needed from the side of physiotherapist. That is, in this case it was acute and comprehensive rehab. So that was the plan of care. Finally, we conclude by saying something like, please don't hesitate to contact me for further queries, something like that, and we conclude and we sign off and we provide our title. So this is the general structure of an answer in writing a letter in OET exam. This is a very basic introduction. I'm again saying that we will in detail deal with how to write a purpose, how to write conclusion in our full classes. Now, while you write, what are the things we need to remember? We need to keep a clinical accuracy in whatever we write. It should not be a jumbled up group of information. It should be logical, it should flow, it should be precise. Because these healthcare professionals, we consider healthcare professionals to be very busy people. They won't have time to read a lot of unstructured and illogical information. So we need to provide clear, crisp, concise, accurate information through our letter. Now, what are the other things we need to keep in our mind? Who is the reader? Here the physiotherapist is the reader. So the physiotherapist may not require certain information. For example, what was the heart rate while the patient was in hospital? That is not required for the physiotherapist now, because the physiotherapist will require information related to physical mobility, not heart rate or BP, until and unless it is affecting the treatment the physiotherapist is going to give. All information, all such medical information is irrelevant for the physiotherapist. So what are the information the physiotherapist would require to give adequate care to our patient? Those information must be prioritized and provided. Okay, so discharge plan is very important because that is the action that will be taken, that is the cue for the action to be taken for the physiotherapist. And the nursing management is also, we need to pick up certain information selectively. As I said, heart rate may not be required for a physiotherapist. All right, and also when you write the paragraphs, often we tend to write, okay, the patient was admitted on day 1, then he was given treatment on day 3, at present his status. That is the chronological way of writing paragraph. Or else you can thematically arrange. For example, suppose the patient has some serious case of a cancer, so then we have to prioritize that. So there might be a primary medical concern, and the person might, along with the cancer, the patient might be having some allergy, so that will be your secondary medical concern. So the primary medical concern we will prioritize that, and after which we will write the secondary medical concern. So paragraphing can either happen either way. It can happen chronologically or it can happen thematically. And we must remember, throughout the essay we must maintain a formal tone. We tend to use the passive voice as a part of this. For example, we won't say I discharged the patient, rather we say the patient was discharged. So using a passive voice will help to give a formal tone to our letter. Now, how is this letter assessed by the examiner? So after writing the exam, your letters will be sent to Australia, where 2 assessors will be looking at your test paper. So what are the things that they look in your letter? First, is the purpose clear? That is the first thing, the clarity of the purpose and how the purpose is expanded throughout the letter. Purpose being, so especially the first sentence, I am writing this letter to XYZ care from your side for my XYZ patient. So the purpose should be clear. And the content, are you giving unnecessary information to the patient or to the professional? That is evaluated. Then the clarity, the flow from one paragraph to the another. How are you summarizing? How are you grouping the information? So those things they will evaluate. And the genre and the style means, are you maintaining a formal tone throughout your letter? Are you sufficiently expanding the abbreviations? All these will be looked at. And then organization and the layout. So is there a flow in this letter from point A to point B to point C? That will be observed in this exam. And finally, they look at the language. The accuracy of the grammar, spelling mistakes, vocabulary issues will also be analyzed or assessed by the examiner. So accordingly, you will be given score. For example, for purpose, you will be given marks out of 3, and all other components you will be given a mark out of 7. So at least you will be getting 2 out of 3 and 5 out of 7 to get a B band in OET exam. So this is the general structure of writing test in OET. Don't worry if you feel that you have missed some point. Do not worry. We will deal in detail with every component. Purpose, we'll spend some time and understand how to write purpose, how to draft the right group of words for purpose in our practice sessions. Now we will move to speaking test. In the speaking test, you will be interviewed by an interrogator, where you have to perform role plays, and they'll be asking you warm-up questions, etc. Let's try to understand it. So first, the speaking test will begin by warm-up questions, where the interrogator will be asking you some questions about you. Why do you like this profession of nursing? How long have you been working? What are the challenges that you face? Some random questions about your profession, about you. This section is only to understand you and also how you speak, and to get used to with your pronunciation of words. And remember, this session is not assessed. This is only for the examiner to get familiarized with your tone and pronunciation and etc. and your pace, etc. All right. And after warm-up questions, you will be provided with a cue card in which a situation will be given where you are talking to a patient or a patient's relative. Okay, so you are trying to, maybe you are clarifying some doubts to a patient, doubts of a patient, or providing some information. So like that, some scenario will be given, and the interlocutor will be acting as a patient or patient's relative. You will be acting as a nurse, and you will be communicating with the interlocutor as a nurse, and the interlocutor will act as a patient or patient's relative. So you will be provided with a cue card, and after getting the cue card, you will be given 3 minutes to prepare to what kind of question should I ask, what kind of answer should I provide, how should I go about it. So you have 3 minutes to plan, after which the role play will begin. So the interlocutor will act like a patient, and you will respond and try to, will show empathy, you will try to understand the patient, you will try to reassure the patient, and try to solve the situation that is there in place. So after the completion of the first role play, again you will be provided with another cue card for the role play 2, for which also you have 3 minutes to prepare. After 3 minutes, again you and the interlocutor will go forward with the second role play. So the settings might be a ward, you might be a nurse in a ward or an emergency department, or even you might be a community health nurse visiting a patient at their home, a patient at her home. Okay, so this is also for 5 minutes, and almost the whole test will last for 20 minutes. 3 plus 5 plus 5, and sometime for speaking and neglecting. So in total it won't go beyond 20 minutes. So that is the general structure of the speaking test. Now this is the cue card. So look at, this is the candidate card. So you will be provided this, and the examiner will be having a cue card or a role play card like this with themselves. Okay, so look at here, there is the setting is provided, that is hospital casualty ward, and you are provided with a background. Here the patient had to go through an accident, and is in need of blood transfusion. So the patient is having a lot of concerns. The patient is worried about receiving blood from some other person, possibility of infection. They're worried about how will they recover after, recover in the future. So a lot of worries this patient is having. So we need to talk to the patient and console the patient, and to create awareness in the patient, and you have to perform as a healthcare professional throughout your conversation. So that is the goal provided. So you're provided with 4 tasks in this letter. You need to complete these 4 tasks in the 5 minutes given here. So accordingly, the role player will ask you questions, and you will also respond. You will also ask the patient the relevant question to understand the patient. Alright, so this is the cue card that will be provided, and based on which you will try to answer. So similarly, 2 role plays will happen in the speaking test. How will you be assessed in this speaking test? So there are different parameters. For example, intelligible. So first set of parameters are known as linguistic parameters. How you speak is the linguistic parameter. Second is the clinical communication parameters, whereas what is the content of your speech? Is it helping the patient? So that is being assessed in the communication criteria. So intelligibility means how is it audible? Is it clear enough? The fluency, is it troubling the patient when how fluent are you in the language? Is the language formal or informal or appropriate to the occasion? Is it, suppose you're in an emergency department, is it showing some urgency? Okay. Accordingly to the situation, is your language appropriate? And also the grammatic structure of your language. The communication criteria, are you building sufficient relationship with the patient so that the patient is at ease? Or are you providing a structure, a logical structure to your response? Are you collecting information from the patient and trying to understand the patient? Are you providing the information the patient is not aware of? So these aspects will be monitored and assessed in the communication criteria. Don't worry, in the speaking tests, in the sessions that we will provide you detailed assessments on how to deal with these aspects, how to ensure that we are meeting each of these criteria when we speak for those 5 to 10 minutes. Okay, so that those issues will be dealt with in our practice sessions. So what all are we providing? So we have different sets of program. Daily writing only program, daily speaking only program, daily writing and speaking, and the full course where writing, speaking, listening and reading will be provided. So the uniqueness of the NUTS OET sessions are, it is one-to-one. We provide you support then and there itself. It's a live through different mobile apps or by direct call. We will sit with you, we'll work with you to deal with your doubts or whatever problem that you're having. We'll teach you, we'll push you to practice, we'll give you reviews. So that one-to-one and live interaction is one of the unique feature of the OET session. And we have our faculties who can speak different languages, regional languages like Malayalam, Hindi and all. So you won't have difficulty. Suppose you have to speak in regional language also apart from English. Okay, and our specialty is the focus on weak area. Instead of teaching a lot of theory, we believe in giving instructions, supportive instructions based on which you will practice, and based on your practice we will give you review, and based on that review you can improve your practice. So we believe in that circular improvement cycle than linear provision of information, just providing, feeding your brain with information. We believe in the cumulative development, day by day improvement of the candidate. Okay, so normally our program is for 30 days, and we also provide a 1 week support, free support before the exam. On the week just before exam also we provide 1 week support, and our program is structured for 30 days, by which we assume that we believe that all students will be capable to write the OET and get a score of a band of B. Alright, so and also yeah, if it's a full course, our structure is like this. In the first week we'll be starting with writing and speaking, then we add reading to it in the second week, and by third week we'll add listening, and in the final week we'll have advanced training focusing on your weak areas, and then exam simulated full and sectional tests. So this is the structure of the full course of the NUTS OET sessions. So to summarize, to conclude, we only want these things from your side. It doesn't matter what kind of English background you're having. You might have not studied up to 12th in an English school, or maybe you have not given sufficient opportunity to speak English while you are studying your undergraduation or while you are working. That is not a problem for us. For us, you only need to have these 4 things. Are you determined to clear this exam? Are you ready to hard work? Are you ready to hard work every day? And are you ready to adapt when we point out to you the mistake areas to improve? If you have these 4 skills, we are ready to provide you 4 other things. That is, we'll provide you perfect guidance, we'll provide you doubt clearance at any basic level. If you have issues in grammar, if you have issues in pronunciation, don't worry, we'll get down to your level and try to clear your doubt. And we provide daily support. We respond to you immediately, and on a daily basis. And our practice sessions, we ensure that are simulated to the real exam that you will face. So you just need to have these 4 things. We will provide you these 4 things, and we are particularly sure that you will be able to reach the summit of clearing OET exam with a minimum of band B. Yes, so that is about this introduction class. Thanks for listening to me. Hope to see you soon. Thank you.